You are now going to complete a clinical application activity. The objectives for this activity are for students to effectively interact through oral and nonverbal communication with a client in a professionally acceptable manner. Carry out a client-centered interview in order to identify client's home environment, social supports, pain level, and orientation. And create interview questions that identify potential impairments in occupational performance and help determine the client's goals for improving occupational performance. This activity should prepare you for your interviews with your older adults, as well as all the other activities that you will be performing with older adults throughout this semester and the fall. You're now going to go onto the website for the ICE Learning Center. ICE videos are real life clinical situations that have been recorded. They are not scripted. They are not planned out. They're exactly what is happening in practice. The video that you're going to search for is titled Assessment in Acute Care, Part 1, Initial Interview. Type it in exactly how you see it on this slide, and the password for the ICE videos is provided for you here. This interview is conducted by a physical therapist. It does not matter that he's a physical therapist. It's the interview skills that you're really going to be learning about in this video and this activity. The video is 5 minutes long. Once you are finished watching the video, you're going to post on the Canvas discussion board just a 1-paragraph reflection using the prompts listed on the next 2 slides. You do not need to hit on every single point that's listed on the next 2 slides, but you should take the time to think about all them. So this is what I want you to put on the discussion board. Feel free to interact with each other on the discussion board. I don't think it's necessary for me to say you must, reply to at least 1 post or must reply to 2 posts. If you read someone's and you feel inclined to respond to what they wrote in their reflection, please definitely do so. But just always remember to be respectful and to be mindful of all of our different perspectives and where we're coming from. So some of the considerations you can discuss are: how does the clinician develop therapeutic rapport with Mrs. Finley? How often should a clinician ask the client about his or her pain level? What did the clinician do well when asking about pain? What could he have done better? Asking questions about orientation can be awkward but necessary. How did this clinician make it less uncomfortable? And what questions could the clinician ask next? Here are some additional considerations. How does this 5-minute interview help you organize and plan for your objective portion of this individual's evaluation? What evaluation areas do you think might be a priority? What objective assessments might you use? How would you document this subjective information in an objective manner? How is the clinician's demeanor similar or different from clinicians that you've observed previously? So go ahead, jot down your thoughts and just write a well-organized 1-paragraph response to some of these prompts on the Canvas discussion board. Thank you.